Hi guys, so we are going to continue our conversations surrounding both paralysis and now switching gears to Clostridia. So we are going to talk about two more organisms that are in the Clostridia genus. We've already talked about C. perfringens. We talked about that back in your Jamie Lopez case. And we've also talked about C. diff. Right, so we talked about that during your food to fuel block when I believe when we talked about diverticulosis. So if you think back to C. perfringens and C. difficile, you should remember a couple of key things regarding the Clostridia. These are hardy organisms, and part of the reason they're considered hardy organisms is that they all produce spores, right? So the spores are what enable these organisms to survive for very long periods of time in very harsh environments. The spores are resistant to most of our cleaning solutions, often resistant to heat, acid. They can survive for forever. Remember, this is Kell-El's escape pod. This is what enables the organism to regrow once it gets into a nutrient-rich, good environment for vegetative growth. We're now going to talk about Clostridia botulinum, which is basically the causative agent of botulism. And then the second video that's going to go along with this module is Clostridia tetani. And the reason we talk about these two together is that they actually, besides both being Clostridia, they actually both cause paralysis. They just cause very different types of paralysis. Okay, so first off, some main characteristics. It's a Clostridia, so this is a gram-positive rod, right? All of the Clostridia are gram-positive rods, so that's kind of the appearance that we would see on a gram stain. These are fastidious organisms, and as I mentioned in the introduction, they are spore formers. They are also anaerobic organisms. So remember, we talked about this with C. perfringens, that maybe some dirt or soil gets into a wound, the wound closes up, aerobic organisms in the area eat up all the oxygen, and then the C. perfringens can grow out. C. diff does very well in the gastrointestinal tract where oxygen is limited and there are plenty of aerobes to eat up the oxygen. C. botulinum, the anaerobic nature of it is actually part of how we actually associate it with disease, because we really associate it with kind of improperly canned foods, okay? So I don't know if any of you have ever been canning. I have not, but I had a friend in grad school that her and her grandmother every year would can green beans and vegetables from her grandmother's farm in Indiana. So when we think about the types of food that might lead to botulism poisoning, we're thinking about alkaline foods like green beans. We're not thinking about acidic foods like tomatoes. The tomatoes will actually kill off the organism, the vegetative organism, with their acid. So it's really only these alkaline foods that are actually kind of our bigger danger. We can also find them in the soil. The soil is a great place for C. botulinum to grow. So the main problem with C. botulinum isn't necessarily the organism. It's the toxin. It's botulinum toxin. It's the main mediator of the disease, but it's also now been harnessed by Hollywood to treat its most feared disease of wrinkles or aging via Botox. So most of you have probably heard of Botox. Botox is just basically botulinum toxin that people are injecting into the wrinkles in their face to actually cause the flaccid paralysis that this neurotoxin causes locally, thus releasing the wrinkle. But what it actually does, where it actually causes disease, is a descending flaccid paralysis. This is kind of a buzzword when you think about C. botulinum. If you see descending flaccid paralysis, we're talking about C. botulinum. And this differentiates it from C. tetani, which is an ascending rigid paralysis. So that's kind of one of the ways you can keep them straight. The toxin itself is pretty hardy as well. It's heat labile, but it's resistant to enzymes and low pH. So even though you can kind of heat it up and get rid of it, the enzymes in your stomach, the low pH of your stomach is not going to break it down. And that's part of the reason why we worry about it when people have ingested it. So they can ingest the toxin and then we can still get sick by the effects of the toxin. So how does it actually work? Well, it works by basically inhibiting transport of acetylcholine across the cell membrane. And if you've already watched my myasthenia gravis video, we've already talked a little bit about the role of acetylcholine in normal muscle contraction. So in this case, what's going to happen is that the neurotoxin is going to travel to the peripheral nervous system, where it's going to cleave these snare proteins. So snare proteins basically create these, you've got this synaptic vesicle, and the snare proteins are going to form a complex, all right? And then you've got this acetylcholine receptor, and the acetylcholine binds here, right? So you've got your snare proteins, which is kind of this piece of yarn looking thing here, and that's going to bring your synaptic vesicle close to where it needs to be, close to this basement nerve area in the synaptic cleft, where you've got your acetylcholine receptors on the muscle cell. And now when the snare protein kind of gets you here, now the acetylcholine can come out, bind to its receptor, and go across, okay? Now, when you have botulinum toxin, the snare proteins basically get destroyed. And when that happens, this doesn't get directed to the basically edge to that synaptic cleft the way we need it to in order to allow for the release of this acetylcholine, okay? So if you cleave snare, you basically inhibit the transport of acetylcholine across that nerve cell membrane. And acetylcholine is absolutely necessary for muscle contraction. So when you inhibit the acetylcholine binding here, you inhibit muscle contraction, and that's what leads to flaccid paralysis. And that's also why when people get Botox, we have these Hollywood actors and actresses that can't raise their eyebrows anymore, because you need to be able to contract facial muscles to do that. Okay, now that we've talked about the toxin, botulinum toxin, and we know the mechanism of action, we need to talk about the disease, or botulism, as it's more commonly called. With botulism, you actually only have a fairly short window. It's an incubation period of about 18 to 96 hours. So you don't have a lot of time to figure out what's going on from the time your patient ingested the toxin to the time they actually start showing symptoms. Symptoms are that flaccid paralysis, and they actually don't differ that much from some of the symptoms we started to talk about in myasthenia gravis. Just the time course is different because this is toxin mediated. So you can see ocular, pharyngeal, laryngeal, and then respiratory paralysis is actually the thing that leads to death in most cases. So what happens is that as the acetylcholine is blocked from being released, you no longer get that muscle contraction of your respiratory muscles, so they're no longer able to kind of contract to allow your lungs to fill with air. So you wind up having people who are basically asphyxiating because they can't contract their muscles. About 10 to 20% of patients will die even with aggressive treatment, because as long as that neurotoxin is still present, you're still inhibiting the release of acetylcholine, and the paralysis will just continue. Now, botulism, thankfully, is fairly rare. But if you're going to get a question on botulism, you're going to get it on one of three things. One, the toxin mechanism of action, which we've talked about, so you know that. Two, can you differentiate it from C. tetani, which we've talked about a little bit. Botulism, descending flaccid paralysis. Tetani, ascending rigid paralysis. So as long as you can keep that one straight, then you're good. Remember your buzzwords. The last thing that people are going to ask about, and this is kind of the big one, is adults versus infants. Because it's not so much that the disease is different, it's the mechanism by which they get disease. So the key things to keep in mind is that with adults, it's due to ingestion of the pre-formed toxin. With infants, it's ingestion of vegetative bacteria that leads to disease. So let's dig into that a little bit more. Okay, so let's start with adult botulism. With adult botulism, I want you to go back and think about my friend who was canning green beans with her granny on the farm in Indiana. So this is my friend, her and granny canning some green beans. You're going to do this when you're harvesting the beans, right? So let's say, I don't know, I never did this, but let's say it's in like August, all right? Now, they love these green beans. This is a bonding experience, and it's great. And they're chatting while they do it, and maybe they don't wash the beans so good. Well, that's a problem, because the beans then have some dirt in there with them, right? Guess what lives in the dirt? C. botulinum. Now, this is August, and as they're talking about these green beans that they're canning, they're thinking ahead to the holidays, to Thanksgiving, when they're going to make Granny's famous green bean casserole. Delicious. All right, here's the problem. This is now end of November or maybe December, depending on if she could go home for Thanksgiving or not. In the meantime, the organisms in this can are going through their own growth, right? And as they grow, they're using up all the nutrients. As they use up the nutrients become limiting, the environment becomes less friendly, and they do two things. They produce spores and they produce toxin. So as the vegetative organisms die off, you get spores and you get toxin. And that makes this can a like hotbed of toxin. So then fast forward all the way to the holidays, and my friend is helping her granny make that green bean casserole. And as she does that, she pops one of these unwashed green beans that her and granny canned months and months and months ago into her mouth as she's putting together the casserole. The casserole doesn't have the toxin. You're going to cook that. Remember, it's a heat label toxin. But the toxin was in these unwashed things. So now she eats this 18 to 96 hours later, she could start experiencing some of the symptoms we associate with basically adult botulism. So in this case, we're talking about things like blurred vision, fixed and dilated pupils, drooling, because you have that pharyngeal and laryngeal involvement. So drooling, dry mouth, kind of an upset in your ability to swallow your own survival. And then we're going to continue to see it move down. So you can get digestive tract constipation, abdominal pain. This is a toxin-mediated illness, right? So what does that tell us? No fever. If it's just the toxin, there's no fever. We don't have an inflammatory response to it, but the patient is still sick. And if my friend doesn't get care very quickly, that'll help kind of abate the symptoms of the toxin and help her breathing muscles work while we wait for the toxin to kind of run its course and new acetylcholine to be produced, then the disease may progress and she could suffer respiratory paralysis. So the spores are inadequately heated and killed, or not killed. You've got an alkaline vegetable in an anaerobic condition that's going to lead to production of the toxin. And that's what's actually going to lead to the symptoms. And I'm showing some of them here. Here's that drooping of the eyes, the fixed and dilated pupils here. Okay, infant botulism, very, very different. Remember, with adults, we were talking preformed toxins. With infants, we're actually talking vegetative bacteria. So I don't know if I've said this to you guys before, but I am convinced that babies actually have kind of a death wish. They kind of flop around the world, kind of grabbing whatever they can and putting it in their mouths. Mom's phone, dad's keys, dog hair, does not matter to them. They've decided right out of the womb that putting things in their mouths is the best way for them to identify them. And this becomes a real problem for botulism. So thankfully, this is still a very rare condition in the US. We only get about 75 cases a year, but if you are going to get it, the peak age is 2 to 6 months. Why do you think that is? Well, think about what babies start doing around 2 to 6 months. We have two initiatives right now. One, we have this amazing thing that doctors love to tell new parents to do called tummy time. So we're supposed to put babies on their backs to go to bed. When you put a baby on their back all the time, the back of their head might flatten. So to combat that, during the day, we're supposed to put them on their tummies so that they can kind of crawl around, and also we give that noggin a little bit of a rest. So tummy time. While they're on tummy time, they just kind of grab things randomly and straight into their mouths. You think you have clean floors until you have a baby doing tummy time. The other thing that happens in here, babies start crawling. And when they start crawling, they find all the nooks and crannies now that they're mobile, and they grab dirt and things out of it, even if you vacuum 10 times a day. So they go and they pick up soil, dirt, whatever shows up. The other thing that sometimes could lead to infant botulism are two things. One, honey and dietary supplements. Honey used to apparently be a big concern for botulism, particularly in infants. It's now actually recommended not to give honey to infants until they're much older, at least a year, because of the risk of botulism. Dietary supplements is a strange one. I mean, you're all probably thinking, why does a baby need dietary supplements? Well, we have this initiative right now, and I think it's a good one as an immunologist. This whole, breast is best. So breastfeeding, right? So if you live in Chicago, like me, the sun is not a common sight in the winter, which basically means we're all vitamin D deficient. And that means that baby, if baby is getting breastfed by a vitamin D deficient mom, is probably also vitamin D deficient. So your doctor tells you to go and pick up these vitamin D kind of solution and feed your baby. These things are brown, smell bad, and will stain a onesie worse than anything that comes out the other end of that baby. But the other thing is they are a dietary supplement. So depending on how they've been packaged, there's a potential that they could have some of these spores in them that would have been resistant to the sterilization process that the supplements might have gone into. The other option here for where you might find it is formula, just because that's another place where things could have been sterilized, but maybe incompletely. Okay, here's where the mechanism differs. In this case, it's the ingestion of the spores. So remember, this baby here's this gastrointestinal tract hasn't had a lot of time to create a good general microbiota, right? So without that general microbiota, it doesn't fight off the growth of pathogenic organisms like C. botulinum very well. So when the baby ingests the spores go straight down to this gastrointestinal tract where they find this beautiful, rich microenvironment full of nutrients and plenty of space to move in. As they move in, eventually there's turnover, they start producing the toxin, and the toxin is what leads to disease. In this case, disease is sometimes referred to as floppy baby syndrome, as is shown here. You can see that there's just no muscle contraction happening in this baby. It's not that this baby is asleep, although they might be, but it's that there's just no muscle contraction. The baby's entire body exhibits this flaccid paralysis. At first, the symptoms are nonspecific: weak cry, constipation, kind of this vague failure to thrive phenomenon, and then it progresses to the flaccid paralysis and respiratory arrest. The good news is mortality is very, very low as long as we can get these kiddos on some respiratory therapy. It's only about 1 to 2%. So as long as we get therapy on board quickly, all is well, baby will be fine. Okay, so those are your main differences, right? Adult botulism, we're talking preformed toxin. Infant botulism, we're talking ingestion of spores, and then vegetative growth and toxin production locally in the gastrointestinal tract. Okay, so briefly, let's talk about diagnosing it and treating it. Really, to diagnose it, you just need to confirm presence of the toxin. You can do that in the food, the patient's serum, feces, or GI tract. There is also a very strange test, and I talked to some of my friends in ID to see if this was actually for real. But apparently, what you can do is you can take samples from the patient, say the serum or the feces or whatever, and then you inject them into a mouse and see if the mouse develops botulism. And this is apparently one of the CDC methods for identifying if the patient has botulism, and it is apparently diagnostic. So that's kind of strange, but thankfully not that many people get botulism. So in this instance, this isn't a major concern for the mice of the world. Treatment, two things. Ventilator support, right? Because we're worried about respiratory paralysis. And then there is also a trivalent botulinum antitoxin that can be used to bind up any toxin that is produced locally to kind of slow down the paralysis while we wait for the rest of the toxin effect to go away. Really, we're going to aim at preventing it in the first place. So first off, maintain food in an acid pH. If you are going to go and can those green beans, make sure first that you destroy the toxin by heating it to 60 degrees for 10 minutes before you eat. If you can't do that, maybe spray some lemon juice into those green beans while you're canning, or something else that's going to kind of create a nice acid pH that's going to get rid of that. You want to store food properly, so keeping food at 4 degrees. And if you're a baby, avoid honey, because it's been known in the past, especially some of that fresh local honey, to have some spores in it, which could lead to vegetative growth. That's all I have on C. botulinum. Make sure you watch the next video on C. tetani.